Hello, everyone, and happy 4th of July. I know we are still working. Everyone else in the US is enjoying 4th of July, but we will do that too. But today's session is actually very important for a lot of people, a lot of women. Obesity management and diabetes, they go kind of hand in hand sometimes. How do you do that with diet? And that's what we are talking with Rabia right now. Rabia is a registered dietitian with over 25 years of experience and all kind of different health concerns that you can think of, but today's focus is going to be on diabetes and obesity management. Welcome, Rabia.
Thank you, Amita. So I hope you can hear me clearly.
Yes, we can hear you. So I think what we want to do is we can start with overall diabetes and obesity, the correlation, and then you can talk about the diet part and how it plays the role.
So basically, diabetes is a metabolic disorder in which your pancreas, there are two types of diabetes. We all know that one is which is related where your pancreas is not making insulin at all, and you have to depend on insulin in the form of injections, and you have to take it throughout your life. The other condition is that is more related to lifestyle changes, because it is more related to obesity, it is more related to your lifestyle. It is called type 2 diabetes, which in Western population, it occurs after 35 or 40 years of age, but in South Asians, Pakistani Indians, it is more common after 25 years of age. But just because of our ethnicity, because we South Asians, Pakistani Indians, we have more fat around our abdomen, or the central obesity is more, so we are more prone to these type of metabolic diseases like heart disease or diabetes. So this type 2 type of diabetes, you will be surprised that only 10% of the diabetics are type 1 diabetics who are insulin resistant. The rest are type 2 diabetes. They have type 2 diabetes, and that condition can be prevented by a very healthy lifestyle and diet. So it is a preventable condition, and once you develop it, you can manage it by diet also. And I have seen many my clients and patients who can reduce their medication if they follow proper diet and they follow proper lifestyle. So now, what are the most common or recommended treatment for diabetes and obesity? If you want to ask me this question, then my answer would be that definitely there is commonly people think that there are shortcuts. So there are no shortcuts that you can follow a certain type of diet and you can control your weight, or you can reduce your weight and then you can even finish this diabetes. Diabetes is manageable, but you cannot totally get rid of it. So calorie restricted diet plan, which will help you reduce weight, definitely helps in controlling diabetes also, because experts says that 5 to 10% of weight loss in the first 6 months helps in the management of diabetes. It reduces your HbA1c by 10 to 15%. So it is better if you follow a healthy diet plan and an active lifestyle. You can very easily manage your diabetes, and you will not end up adding to your medications, and of course entering complications which are related to diabetes, like your kidney failure or your retinopathy or neuropathy, which has many, which definitely destroys quality of life. So there are many types of diets. Okay, people think that if, for example, like keto diet was very popular. It has become very popular, and people think that it is a very good diet because it helps. The results are very good. They are very drastic, and you can feel that your blood sugar levels are controlled because you're not taking any carbs. So this is not true, because it gives you a very false picture. Because if you're not eating any carbohydrates, then definitely you are not making any insulin in your body. Then definitely sugar levels will come down. So at the end, you see a broader picture after long term, like following this type of diet, keto diet. Once you go to your normal diet, you end up with a very bad insulin resistance, in which your blood sugar levels becomes uncontrolled. So this is not a very good idea to follow this type of diet, which are very popular diets. Another diet is like people are very this is popular nowadays, is intermittent fasting. It definitely helps in weight loss. If you think of weight loss only, it is a good approach. But if you think of diabetes, because your diabetics are taking so many medications also, they are definitely taking type 2 diabetics, many type 2 diabetics who are overweight, they are on sulfonylureas plus medication, type of medication which controls the sugar level, plus they are also taking some insulin. So if they follow this type of diet, intermittent diet, definitely fasting for a longer period of time can put them into hypoglycemia. So this is again not a very good idea to follow such diet. So what type of diet should a diabetic patient or person follow? So it's not one type. Different diets works differently for different people. So the best approach is that you follow, just go take more non-starchy vegetables. Non-starchy vegetables are like leafy vegetables, or like pumpkin or ladyfinger, or like which has less amount of starch in it. Starchy vegetables are like potatoes, sweet potatoes, and yam. This is starchy vegetables. So you have to reduce these and increase more non-starchy vegetables. Plus, then the grains which are taking as your staple food, for example, your roti or your bread or your cereal, it should be high fiber. It should have high fiber. It should not be refined. So shifting from refined grains, refined carbohydrates to high fiber carbohydrate is the next, should be the next approach. After doing that, you have to add more fruits and vegetables. Fruits contains natural sugar, and it is better accepted by our body. For that, even in diabetes, it is better tolerated, because fructose is better tolerated than sucrose, which is table sugar, or the added sugar which is present in many desserts and juices.
Let's see, I think her network somehow.
Eat meat, again, a limited amount of meat like chicken or fish, but not like once or twice a week is it's very good if for your diabetes also, because it is low in cholesterol and saturated fat. Of course, apart from this, definitely a healthy lifestyle, active lifestyle is the key. So you have to follow that also. Take minimum of processed food and shift more towards complete or whole fruits and vegetables, and natural or organic food than processed food, because processed foods contains many preservatives which contains chemicals which are not recognized by our body, and they enter into our body as free radicals, and this creates a chaos in your body, which your body enters into more like a confused state, and your metabolic systems, it gets disturbed. So it is better that you keep more natural foods in your diet than processed. Definitely, we this age is very I can say that it's very difficult for us, because we have so many attractions in the form of junk food and food deliveries everywhere. People, they prefer junk food than home food. So definitely these junk foods contain more saturated fat, more processed food, more trans fat, which is again bad for your health. So if you just restrict this type of food, I don't say that you have to completely stop it, but you can limit it slowly and gradually. So if you do that, definitely your diabetes will get better. So it's a very slow and gradual process. If you take one step at a time and keep on adding healthier things in your diet, definitely you will reach your set goal. So the number one is healthy diet. In your you have to follow a healthy diet. Then you have at least 30 to 40 minutes of physical activity in your diet. You have to start that. A good sleep, meditation, and definitely if you think you have to change your behavior also. Behavior towards your lifestyle, behavior towards your eating. Mindful eating is better if you try to sit on the table and your work. Don't eat while you're watching TV, because in that case you will end up eating more, because you will, if while watching your mobile phone or you're watching TV, you can eat more than your, and mindlessly. Definitely you don't know how much, you don't know how, when to stop, when your mind is somewhere else. So you have to be very mindful while eating. So your behavior also plays a role when you're following a healthier diet plan. So definitely small changes can make a difference. It is achievable, it can be doable. Only through diet you can reduce your medications of type 2 diabetes. You can reduce the insulin units in your, you can lose weight, and definitely this will improve your sugar levels, and automatically there will be a reduction in your medication. So this is, and for those who are seeking that what type of diets are beneficial for diabetes, this is a general diet plan which I have discussed. There is a DASH diet, that is dietary approaches to stop hypertension. It focuses more on carbs, which are whole grain, more on vegetables and fruits, lean meat, small amount of nuts in your, and low sodium. It also works for diabetic, especially those who have hypertension along with diabetes. So DASH diet is very good diet for those clients. Then again, you have a Mediterranean diet, who has such patients who have diabetes along with some lipid complication like high cholesterol levels or heart condition. Then for those, a Mediterranean diet is the answer, because it is low in saturated fat, it is low in red meat, it has more fruits and vegetable based, more dairy, low fat dairy based, and more like seafood based. So that diet works for those who have heart condition along with diabetes. And similarly, there is another diet which is that heart healthy diet, which focuses on only white meat, small amount of white meat, like twice or thrice with chicken or fish servings per week, and the remaining, it focuses on lentils and beans as protein source, or egg whites or eggs as protein source, and the remaining is fruits and vegetables and low fat dairy. So these types of diets works differently for different people who have different types of like diabetes with definitely obesity, but other conditions like heart or high cholesterol, or definitely like renal, if they have someone has renal failure also. But definitely this plant-based diet works for them also, because it has puts less pressure on your kidneys, definitely.
So I think that's really good. So what I wanted to do was, especially the Indian Pakistani food is very rich, right?
Yeah.
So what could be like? Do we need to not consume any meat? I mean, it's especially from north part of India and Pakistan, the meat is quite heavy in the diet, right? So what do you recommend, that we completely let go of the meat altogether, or for diabetes we're talking in this particular case, or we minimize the meat? I mean, what are your recommendations? A simple lunch or a dinner, what would it look like if someone is diabetic and obese?
So I'm not saying that you have to completely just stop taking meat like red meat or even beef. In Pakistan, people, they are malnourished also. They have low hemoglobin levels also. So I'm not saying that you have to limit, but excess of anything is bad. So for example, if you're talking about Pakistan or India and we're talking about lunch, so definitely if you're overweight, then you have to reduce the portion of your roti or chapati, the grain. You have to reduce that. You can have any vegetable with meat, one piece or of like 75 grams or one piece of meat or chicken or even mutton, lean meat, not the fat one. Lean meat will do. It's okay if you take with along with vegetables, or you can have dal also. If you're not many, they don't like meat. Many people here in Pakistan, they are more towards prone to chicken, eating chicken. So they can have chicken or meat, mutton or even beef, but if the portion size is small, they can have that. There's no need to completely like shutting it off. You don't like never taking it in your diet. You can just have control the portion size, and then along with that, they must focus on having raw vegetables in the form of salads also. They can add that, and it will definitely have a very good effect on their sugar levels, because they're taking raw vegetables also in and they complete fiber, which is again beneficial in controlling sugar levels. What happens in Pakistan, that people have this habit of like having fruit after the meal. I don't know, maybe in India is also like that. They when they complete their lunch or dinner, then they definitely they ask for some fruit, and we'll have fruit after lunch or dinner. So I always educate my patients that always eat fruit as a snack, not at the time of lunch or dinner. Eat it as a snack in between meals, so that at one time the portion size is less and you don't end up with large portion size and more glucose in your body. So it definitely, you have to control your sugar level. It should be gradually release of sugar in your blood, not in large portions will end up having your blood sugar levels shooting to more than maybe 200. So it's better that you reduce the portion size, take in between small fruits as snacks in between meals. And for those who have abnormal fasting blood sugar levels, for those we recommend that they should not consume fruits after in the evening. They should consume fruits in the first half of the day, because fruits also have fruit sugar. So if they end up eat more fruits during later half of the day or after dinner, definitely the sugar levels in the morning will be high. So it's better that if they take the fruit in the first half of the day, as at midday, like 1100 hours between breakfast and lunch, or in the breakfast, it is better absorbed or taken by the body, and it will not make your sugar levels go up. So one tip is that. The other is for those who have high sugar levels, fasting sugar levels, it is advisable that they do an evening walk, even especially after dinner. If they do half an hour walk, it will improve their fasting sugar levels also. And of course, it will boost their metabolic rate, and they can lose weight also. Another tip which I give to my clients, for those who want to lose weight, they are overweight, is that they should take light dinner. They should cut down their carbs portion during dinner time. Like if they're taking 2 rotis, they should start taking 1 and then gradually bring it to half roti, because and take more meat, because any meat like chicken or egg or even dal, they will not make, because it has the meat, it doesn't, they shoot up your sugar levels because it has no carbohydrate in it. So definitely, if you take meat along with salad, a small amount of yogurt, and half roti for dinner, your blood sugar levels in the morning will be just fine. So one tip is that. Other than that, definitely, again, it is advisable to take your last meal at least 3 to 4 hours before going to bed. You should not eat just 1 hour or at the time of sleeping, going to bed at night. So this, again, you will end up storing the extra calories in your body and putting on weight. So if you want to lose weight, you have to take light dinner and take it at least 3 to 4 hours before going to bed. For example, if uh, we go to bed at 11, we should have our dinner not later than 7:30, 7 o'clock. So this is another tip which can help manage your sugar levels plus your weight. It can maintain your weight also. Then again, if you want to lose weight, you have to make your diet diversified. You should not stick to a monotonous diet plan. If you stick to a monotonous diet, you're taking same sort of thing in the morning, same sort of thing in the night, just following the same routine, it becomes monotonous and your metabolic rate slows down and you will not lose weight. Because if you want to lose weight, you have to dodge your body. You have to keep on changing the plan, your diet, your different types of food in your adding to your diet so that your metabolic rate, it keeps on the speed, it keeps on moving on and you keep on losing weight. Otherwise, if you follow a very restrictive calorie diet, like 800 calories diet, it will not work after 2 or 3 weeks. Maybe you will lose weight 1 or 2 weeks. Then after that, you will stop losing weight because your body gets used to it. Just like in Ramadan, we keep fast, and for 5 or 6 fasts, we are having issues with, we are feeling hungry all the time. But after 1 week, we get used to that fasting routine, and then we are okay. We in the later last 10 days are okay with most of us. We don't feel anything that we are fasting because our metabolic rate has closed down. It has goes down to adjust the body with that routine. So you have to dodge the body in that if you want to lose weight. This is another tip.
I think this is excellent. All the tips that you've given, even I eat fruit at night, what you just pointed out. So I need to stop that because, and no wonder, it's hard for most of the women to lose weight at the midriff. And that is some of these things that you talked about. Well, I'm going to open it up for questions. Ramsha and Mariam, you can unmute yourself. It's an excellent session from Rabia. This is a quick 10-15 minute session we did. We went a little bit over because we have a live audience. So you can unmute yourself. You can put it in the chat if you have any questions, any feedback. I'm going to give you 30 seconds to see if you have any comments or questions. Ramsha or Maria? Okay. All right. Great quick session. Let's see. No questions. Thank you. All right. Appreciate your support. We are launching our platform, which is going to be very affordable. Okay, so someone has asked a question. Well, Mariam has asked a question. Is it good to start glucophage?
Okay, Mariam, glucophage, basically it metformin, it works two ways. Number one, it helps in the uptake of, helps your body in the getting your blood sugar levels, excess blood sugar levels in the body used up. So you can, the body can use up the excess sugar levels, which is causing high sugar levels. So the other is that it stimulates the pancreas to produce or secrete more insulin. So it is acting in two ways to control sugar levels. Usually it is recommended, definitely it is the first line of drug which is recommended for type 2 diabetics who are overweight. Definitely, because if you are overweight, definitely you have insulin resistance in your body. Insulin resistance is that your body is making more insulin, but it is not doing its work because of some resistance, because of overweight. So it breaks that resistance and helps you lose weight also, and it controls blood sugar levels also. So it is recommended by all physicians. And now it is available in more combination with other drugs, which is a better option. But glucophage is the first line of drug which is given to type 2 diabetics who also need to reduce weight. it helps in weight reduction also to some extent, yes.
So follow-up question from that is cutting off table sugar or desserts completely a good option?
Again, if you definitely, if you want to lose weight, you have to cut down sugar, added sugar, table sugar and sugary drinks or even bakery items. You have to, or even if you have insulin resistance in your body, then cutting all the starchy stuff like white rice or white bread is the answer, because then only you will be able to reach your target weight or reduce your target weight which you're achieving. But you can, if many people, they have sweet tooth, so they crave like sugar, they can have dark chocolate, they can have dates, they can have smoothies, fruit smoothies in the form of with yogurt or fruit salad, they can have as sweeteners to like satisfy their sweet cravings. So this is, but of course, the other added sugar, it should not be taken, but occasionally, yes, occasionally if you can have a small like a small portion of a cake or a dessert. Milk-based dessert is a better option, not mithais. Mithais are rich in ghee and fat, and it is like more destructive than the rest of the meethas. But definitely you can have meetha as a healthier meetha. Like you can have milk-based meetha are not that bad, like kheer or pudding or custard. They are not like bad, but creamy desserts or which have fat in it also, plus they have so many calories also, that are not like recommended if you are targeting weight loss also along with controlling diabetes.
Okay, any other follow-ups before we wrap up today? Well, thank you so much for both of your, Mariam, Ramsha, I think, and Mariam, any other follow-up questions? Okay, all right, I don't see anything. Well, thank you so much, Rabia. Amazing, excellent session. I think to the point, succinct, giving tips, people can follow, all of us, including me, myself. I need to stop eating my fruits after dinner, which is a great point. And Eid Mubarak to every one of our viewers. We have viewers from all over the world. So thank you so much, everyone, for your support. We are launching our platform, which is going to be very affordable. So stay tuned. And also our app is coming. So stay tuned, and happy 4th of July to everyone in the US. With that, thank you.
Thank you.